Well, hey again, everybody. Dr. Beulah here with another episode of Revive videos. These are videos that we do online on a weekly basis, typically talking about things that are going to either help you manage a crisis in your life or enhance your health overall. Now, before I get started on today's topic, which has to do with baseline testing, both functional and structural, let me remind you to please do us all a favor. If you have any questions at all, please ask them. And if you would be so kind as to share this content, you never know whose life you may impact for good. So that being said, let's get right into it. This idea of baseline testing, at the time of this video, we are in August, and every August kids go back to school. And those that play athletes, one of the things they have to do a lot of the times is have a baseline test done for brain function. Why is that? Well, in the world of contact sports, we have this issue of concussion and post-concussion syndrome. So it's really important to get a baseline of how your brain is functioning. So a lot of these baseline tests, a lot of them, maybe not all, but a lot of them are computerized, standardized testing that essentially test how well your brain is functioning. So what does your brain do? Well, it's visual testing, auditory, aka hearing testing, comprehension and complex problem solving, things like that. And so it's really important to get a baseline, because if you're in a physical injury later on down the line, then you can take the baseline test again, assess it to see if your brain function has gone down at all, and that way they won't allow you to return to play until your brain function comes back up, till your brain heals. And that's all fine. That's all well and good. That's what I would categorize as a functional test, meaning it's testing the function of the brain. Now, the point of my conversation today is that we need to also look at structural baseline testing. So what do I mean by that? Well, I mean that your brain, which is both a structural and functional organ, is protected by the structure of your skull. The vertebra, the backbones, the neck bones actually protect the communication pathway between your brain and the rest of your body, aka the nerves, as well as a lot of other structural tissues like ligaments and tendons and muscles. So what do you suppose happens when someone has a concussion? They're going to have some form of a blow to the head, neck, or shoulders. And what happens in that, in theory, is that the brain is going to be jostled about within the skull. But in reality, the brain, to keep it from hitting the inside of the skull, is protected by fluid, the cerebral spinal fluid. And what we know to be true is that when someone has a bad head or neck injury, very often they're going to damage the structure that supports and protects the brain. There's a bit of a whiplash effect, if you will. And when that happens, it can alter the flow of that cerebral spinal fluid that's intended to protect the brain. It can alter the flow of blood in and out of the skull. It can alter the integrity of the range of motion. And here's what basically happens. Let me just play it out for you, because I've seen it multiple times. We will see young athletes in this office, and we are a structural corrective office, right? An upper cervical chiropractic office focused on the alignment of these structures. And very often we will see these students come in months or even years after their concussion. And let me tell you what happens. They have the concussion. In the process, they get damage to these structures. They get a bit of a whiplash, a misalignment, and something in chiropractic we call full-blown subluxation, a misalignment of the structures that's affecting the quality of communication between the brain and the body. At the same time, they develop these symptoms of concussion: brain fog, headache, dizziness and vertigo, slurred, difficulty forming words, etc., etc. Now, those symptoms should clear up within a few weeks if it's simply a brain bruise, a concussion, a functional problem. But for a lot of people, these symptoms continue past 3 weeks, and they are diagnosed with post-concussion syndrome. Why is that? Well, we don't know. Just some people have it, yada, yada, yada. So they get tossed around to different functional therapists. You have vestibular therapy, vision therapy, pain management, etc., etc. All functional, trying to manage the function of the brain and enhance the function of the brain. That's fine. I don't have a problem with that. What I'm saying is that somebody needs to assess the intimate integrity of the skull, the C1 and the C2 vertebra, that alignment of the craniocervical junction, the integrity of the craniocervical junction, is a critical component to maintaining the function of the brain, and thereby, by extension, the function of the rest of the body. So what do we do about that? What are we talking about? All I'm saying is, if we are getting baseline testing for the function of the brain, aka the impact test or other functional brain assessments, I am suggesting strongly that our athletes need to also get a baseline test to the structural integrity of their head and neck. This is not something that is typically done within the school setting. Typically, a stool physical looks at your generalized range of motion, maybe some other generalized tests. But within specific chiropractic offices, there are a lot of very minute assessments to check the levels of integrity on these upper neck bones. And that's just something that I think is really important for anyone to have done, but especially athletes this time of year. So here's my challenge, here's my suggestion as we go into the school year, or even if you're watching this playback at a different time of year, if you've never had a baseline test to check your spinal alignment and the integrity of the function of the autonomic nervous system, of the communication between the brain and the body, may I suggest that you have that done by a qualified chiropractor. If you have any questions on where to find one in your area, please don't hesitate to contact me. If you're within the greater Pittsburgh, Western Pennsylvania area, we'd be happy to be that resource for you. And that essentially closes off my conversation today. Thank you again, as always, for being a part of it. Please do share it. You never know whose life you may positively impact. Ask your questions. I will answer them in future videos, and we'll talk to you then. Bye now.